You're welcome back. It's still Health Matters, and it's time for your interaction and your involvement in the program. The number to call is 01-2206-842. That's 01-2206-842. We were discussing upper respiratory tract infections, and we're still on it with Dr. Doseko. Now, doctor, sometimes I hear people say they've taken their tonsils out.
Yes.
Why would a person just take the tonsils out? Was it an irredeemable situation?
Yes, I think most of the time, by the time a doctor tells you that you should take your tonsils out, you must have been having problems with recurrent tonsillitis, or the size of your tonsils were so large that it's actually becoming an obstructive tissue. It's no longer a useful thing to have in your body.
That's they were growing.
They were growing, yes.
Too large.
Yes, because if you keep on having infection, it swells up, gets red, then you take drugs, it can come down, climb up again when you have exposure to another bacteria or virus. So most ENT surgeons, if your tonsils are no longer useful for you and they are very diseased, either chronically or acute on chronic, they could make the decision that it might be better for you to have your tonsils removed. And then you must also remember that sometimes if you have tonsillitis and it gets so severe that you get very ill, or you have lots of swelling under your chin or around your neck, it means that that organ can actually be a danger to your life. Because if you have severe tonsillitis, like I said, the bug, the bacteria or the virus can actually go into your whole system and poison your system. And the problem with sepsis is that if you don't treat it in time, it can go on a downhill course that even if you come when it's now irreversible, there's nothing you can do about it. So we must always remember when we have infection that nip it in the bud quickly.
We have a caller on the line.
Yes.
Hello. That's Kabiru from Abuja. Hello, Kabiru. Hello. You don't seem to be properly connected to Kabiru.
Hello, yes, this is Kabir from Abuja.
I can hear you.
Doctor, I have a question to ask. I'm having this kind of cough that... Hello? Yes, I'm having this...
We can hear you.
That used to maybe last for at least a month or two. And this happens almost every year. And to go to the hospital. Can you hear me?
We can hear you.
And anytime I went to the hospital, they will maybe diagnose me with, they will give me normal, usual cough drugs for me or antibacterial. And I used to take them, but nothing will happen. There was one time that I was diagnosed in the Air Force Hospital in Jos that I have this allergy. So I don't know, please doctor, what can I do, or what kind of drugs would you recommend for me, so that anytime I'm feeling this kind of cough, I will just take, and then it may maybe just go like.
That seems to be a yearly thing.
Yes. Kabiru, from what you are saying, there seems to be a seasonal pattern to your cough. And so it appears that it may be allergies. But at the same time, I think it's quite important for one not to have treatment just from telephone calls. I think it's important for you to go to your nearest general hospital or federal medical center and let them evaluate you properly. Because you may think that it's allergies and it's something more sinister. So it's very important for you to be seen. And you ask questions. You tell your doctor who's going to see you that you want them to evaluate and see whether this is asthma. Because allergies, cough, it's very possible that you have asthma. So they need to rule that out. But they might have to rule out that there's nothing extra in your lungs or in your upper airway.
So to evaluate him, would he have to go through some tests?
Yes, there are some tests you can do that can give you some idea on whether there's an allergic element as the etiology of that cough.
Okay, so, because in his case now,
yes,
he seems to have been going
yes
for a while,
yes,
several years, but he doesn't seem to be getting any relief. So perhaps they should actually,
Yes, there are some tests you could do that would help you in deciding if Kabiru is a person who has, number one, allergies, and if his allergies are giving him symptoms of asthma.
Okay. Now, we were talking about the tonsils.
Yes.
The tonsils have, we have a caller on the line. We'll get back to that.
Okay.
Hello. Hello. I think we lost the caller. The tonsils had, something they were doing. There was a function.
There was a function.
In removing them, would that function be left undone or replaced, or does the body have a way of compensating?
Well, the body does have a way of compensating, because the older you are, your body, your immune system grows. So, it's much when you're younger that you need your tonsils. And if your tonsils are going to be a cause of a lot of problems, particularly, like I said, obstructive tonsils. You'll see some persons, children, and even young persons, when their tonsils get swollen, they almost meet. They call them kissing tonsils, and they snore. Oh yes, they snore. They have very noisy breathing, and you see their chest moving in and out when they're sleeping. And the effect of this, if you don't have enough air going into, you can develop some problems with the blood vessels in your lungs, which will now become very tight. Okay. And that can now lead to your heart having to work extra hard, because your heart is now trying to pump blood into the lungs, and the blood vessels in the lungs are very tight. And this can lead to heart failure. They call this cor pulmonale.
All because of two tonsils?
Yes, all because of two tonsils, yes. And it could also be because of swollen adenoids.
Those adenoids,
yes,
do they also get to remove them sometimes?
Yes. Before, I know this is quite controversial with a lot of doctors, because a lot of doctors previously were taught that, leave the adenoids, even if they're enlarged, even if the child is snoring, the child is restless at night, the child goes blue sometimes, leave it alone. The tonsils the adenoids will go small, because the adenoids in particular, they regress. They could be a bit with age. Yes, when you're an infant, a toddler, they'll be a bit little prominent, but they actually just get smaller and smaller. But I say, if you have enlarged adenoids and it becomes a problem, i.e. the child snores at night, the child is restless. Why it's restless is that the oxygen level in the bloodstream drops. So the child just suddenly startles and wakes up and positions herself. You have recurrent ear infections, because your adenoids are at the end of a tube called eustachian tube,
and that's
which drains the middle ear. Yes, and if that eustachian tube is blocked with an enlarged adenoid, you're going to keep on having recurrent ear infections. And like I told you, when you have localized infections as a child, or as an adult, it's very easy to spread and become sepsis. And people die from sepsis, not only here, all over the world. So it's very important, if your adenoids are giving you problems, if your child is symptomatic, you should see a pediatrician and an ENT and have an evaluation. Is it better to take these adenoids off? Because again, if your ears is full of fluid and is gooey fluid, like a gutter that does not drain well, you will see the water there is gooey.
Does the patient actually get to see the fluid?
No, because it's trapped in the middle ear. There's a membrane at the end, so you can't see it. But what it can do is that it makes you prone to having recurrent infections, and it can even damp down sound, so the child may have a hearing loss.
Okay, I understand there's a caller on the line. Hello?
Let's call again.
Perhaps you can try to call in again.
Yes.
Now, some people end up using over-the-counter cough mixtures,
Yes.
cold remedies,
Yes.
and they end up using 3, 4, 5 bottles of cough mixture. Are there
Yes.
no unpleasant side effects or allergies resulting from
I think
such heavy use?
any overdose of any drug will all have its side effects.
But you know, cough mixture is
Yes.
such a pleasant tasting,
Yes.
you know, and nobody really thinks they're taking an overdose of it. It's
Soothing. No, I think in every drug, you know, there's a recommended dose and recommended duration, and I think over here, you know, we overuse our cough syrup. Like I said, if it's a simple cold, simple things like, you know, they found you take your vitamin C, your zinc, you do steam inhalation, you can put some eucalyptus or, you know, some mentholated rubs, put in a bit of warm water, cover your head, inhale it. It will help to decongest. There are also air humidifiers that are around. And I'm a medical person with formal training, but I also find ginger very useful when you have upper respiratory tract infection. So
chewing it, or
yes, chewing the ginger or making syrupy, you know, fluid with the ginger and drinking it, putting it in a flask and drinking it, and of course taking your paracetamol regularly, and gargling, you know, gargling with salt and water can be very helpful in upper respiratory tract infection.
Finally, in just a very short time,
yes,
what does a mother have to see in a child to feel, you know, the urgency of the situation and take, because, you know, kids can't talk, babies can't talk. What would make her carry her baby to the hospital?
Number one, I would first make a statement, and I'm saying it assertively. We have very poor health-seeking behavior in Nigeria. And the reason why we lose a lot of our babies, a lot of our children, is we get to hospitals late. And so there needs to be more hospitals by the government, by NGOs, by private sector entrepreneurs, because we need to create more access. That means we need to have services that are easier for people to come through, go out, because it's this long wait, you know, or the high cost of care that keeps patients. So our mothers need to be worried if our children are irritable, if they have a high fever. Any child has a fever more than 37.4. When it comes to children, must go straight to the hospital. Don't wait for it to get to 38. It's the adults that can wait a bit later, because children can deteriorate so quickly. And when we go to hospitals, I always insist that blood tests must be done, because the children can't talk.
It's been wonderful speaking with you. We really have to go. Totally run out of time. Thank you for being with us today. Thank you for staying tuned. Have a great day. I'm Mary Alale Yusuf. Thank you.